Hello and welcome to our presentation on Medicare ABNs, or Advanced Beneficiary Notification of Non-Coverage. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The Advanced Beneficiary Notification of Non-Coverage, or ABN, is used to give Medicare beneficiaries notice that Medicare does not or may not cover a service and that the beneficiary will be liable for payment. A healthcare provider or notifier who fails to comply with the ABN instructions risks financial liability and/or sanctions. The Medicare contractor will hold any provider who either failed to give notice when required or gave defective notice financially liable. A notifier who can demonstrate that she or he did not know and could not reasonably have expected to know that Medicare would not make payment will not be held financially liable for failing to give notice. These are situations where the provider must give an ABN to the beneficiary before providing services. When an item or service is not considered reasonable and necessary under Medicare program standards, common reasons for Medicare to deny an item or service as not medically reasonable and necessary includes experimental, investigational, or considered research-only services, not indicated for the diagnosis and/or treatment in that case, not considered safe or effective, and more than the number of services Medicare allows in a specific period for the corresponding diagnosis. Also, when custodial care is furnished, the cross-out is for the old outpatient therapy services cap exceptions, and before caring for a beneficiary who is not terminally ill but in hospice, and before caring for a beneficiary who is not confined to the home or does not need intermittent skilled care but giving home health services. To be acceptable, the ABN must give the beneficiary a reasonable idea of why the notifier is predicting the likelihood of Medicare denial, so that the beneficiary can make an informed consumer decision whether or not to receive the service and pay for it personally. Listing several reasons which apply in different situations without indicating which reason is applicable in the beneficiary's particular situation generally is not an acceptable practice, and such an ABN may be defective and may not protect the notifier from liability. For physical, occupational, and speech therapy services, should we look towards the Medicare manuals, the contractor's local coverage determinations, and the national coverage determinations, and also guidelines and literature of the professions of physical therapy, occupational therapy, and speech language pathology for guidelines on what is considered medically necessary and reasonable and necessary. ABNs are not required for care that is either statutorily excluded from coverage under Medicare, i.e. care that is never covered, or most care that fails to meet a technical benefit requirement, such as lacks required certification. However, the ABN can be issued voluntarily in place of the notice of exclusion from Medicare benefits for care that is never covered. I highly recommend using an ABN when you want to hold the beneficiary liable for payment. Even if the services are never covered and you don't technically have to do it under law, it is good to have written notice on file, and so the beneficiary has notice of it. It's written down, it's in both records, and if any conflict arises, you have it to show CMS or the Medicare contractor. Care that is explicitly excluded from coverage under Section 1862 of the Social Security Act includes services for which there is no legal obligation to pay, services paid for by a government entity other than Medicare. This exclusion does not include services paid by Medicaid on behalf of dual eligibles, services required as a result of the war, personal comfort items, routine eye care, dental care, and routine foot care. There's also a much larger list of services that are never covered, but this gives you an idea. When not to use an ABN, you should not use an advance written notification of non-coverage for items or services you would furnish under Medicare Advantage program. So if the patient comes in and they're part of a Medicare Advantage plan, rather traditional Medicare, you're not going to use this traditional ABN, the regular ABN form. You're going to use the form that's provided on the Medicare Advantage plan's website. Also, you cannot issue a ABN to shift liability and bill the beneficiary for services denied due to a medically unlikely edit. It's an NCCI edit that is the top amount of units you can bill for a particular service in a day. A beneficiary in a medical emergency or under great duress, compelling or coercive circumstances. Advanced written notification of non-coverage use in the emergency room or during ambulance transports may be appropriate in some cases for a medically stable beneficiary who is not under duress. Charge a beneficiary for a component of a service when Medicare makes full payment through a bundled payment, or transfer liability to the beneficiary when Medicare would otherwise pay for items and services. The issuer of the ABN includes usually called notifiers. This can include physicians, therapists, suppliers, and our utilization review committees for the care provider. In this case, for therapists, it should be the primary therapist on the patient's case. Triggering events can include the initiation of services that wouldn't be covered, a reduction of services if the extra services won't be covered, or termination of services that would not be covered anymore. An initiation is the beginning of a new patient encounter, start of a plan of care, or beginning of treatment. If a notifier believes that certain otherwise covered items or services will not be covered, or as in they're not reasonable or necessary at the initiation, an ABN must be issued prior to the patient receiving the non-covered care, or if the therapist just believes services may not be considered medically necessary by Medicare, and to do so just in case Medicare decides to deny coverage. Also, example, a new patient schedules an appointment with the therapist for general exercise or non-covered service such as dry needling, you would issue an ABN before providing those services. A reduction occurs when there is a decrease in a component of care, i.e. either frequency or duration. The ABN is not issued every time an item or service is reduced, but if a reduction occurs and the beneficiary wants to receive care that is no longer considered medically reasonable and necessary, the ABN must be issued prior to delivery of the non-covered care. For example, Mr. T is receiving outpatient PT 5 days a week. After meeting several goals, therapy is reduced to 3 days per week. Mr. T wants to achieve a higher level of proficiency in performing goal-related activities and wants to continue with therapy 5 days a week. He is willing to take financial responsibility for the cost of this 2 extra days of therapy that are no longer medically reasonable or necessary. An ABN would be issued prior to providing the additional days of therapy, and Mr. T would agree to pay for those out of pocket. A termination is the discontinuation of certain items or services. The ABN is only issued at termination if the beneficiary wants to continue receiving care that is no longer medically reasonable or necessary. Ms. X has been receiving covered outpatient OT services and has met her treatment goals and has been given exercises to do at home that do not require therapist intervention. Ms. X wants her OT to continue to work with her even though continued therapy is not medically necessary. Ms. X is issued an ABN prior to her OT resuming therapy, where she agrees to pay for continued therapy with cash. You must use Medicare's specific authorized form. You can find it online at cms.gov. The best way to do it is to go to cms.gov and go to the search box, type in ABN, and then the ABN page should come up, and you should be able to find the ABN form to download easily. The ABN is available in both English and Spanish under a dedicated link on the web page. Notifiers should choose the appropriate version of the ABN based on the language the beneficiary best understands. You also may have to engage with a translator if the beneficiary speaks a language other than English or Spanish. A minimum of 2 copies, including the original, must be made, so the beneficiary and notifier each have one. The notifier should retain the original whenever possible with the patient's medical records. Notifiers may reproduce the ABN by photocopying, digitized technology, or another appropriate method. All reproductions must conform to the applicable form and manual instructions. The ABN form must not exceed 1 page in length. However, attachments are permitted for listing additional items or services if necessary. If attachments are used, they must allow for clear matching of items or services in the question with the reason and cost estimate information. The ABN is designed as a letter-size form. If necessary, it may be expanded to a legal-size page. Simply put, you should use dark ink or typed ink on white paper and nothing else. You must use a clear font, such as Arial, Arial Narrow, Times New Roman, and Courier. Font style and formatting must be maintained regardless of the font type used, and it should be at least 12 points, usually 14 to 16 at best, and at smallest 10 points. But the real important thing is that it should be clear to the beneficiary and make sure they understand it. Notifiers are permitted to do some customization of ABNs, such as pre-printing information in certain blanks to promote efficiency. For example, in the letterhead, you can put your logo or pre-print your practice's information. Notifiers may develop multiple versions of the ABN specialized to common treatment scenarios using the required language and general formatting of the ABN. Blanks G through I must be completed by the beneficiary or his representative when the ABN is issued and may never be pre-filled. Lettering of blanks A through J should be removed prior to the issuance of an ABN. Blank A, notifiers must place their name, address, and telephone number at the top of the notice. This information may be incorporated into the notifier's logo at the top of the notice by typing, handwriting, pre-printing, or using a label or by other means. Blank B, notifiers must enter the first and last name of the beneficiary receiving the notice, and a middle initial should be used if there is one on the Medicare and the beneficiary's Medicare card. The ABN will not be invalidated by a misspelling or missing initial as long as the beneficiary or representative recognizes the name listed on the notice as that beneficiary. Blank C, the identification number. This field is optional. Notifiers may enter an identification number for the beneficiary that helps to link the notice with a related claim. The absence of an identification number does not invalidate the ABN. This should be an internal filing number created by the notifier, such as a medical record number. Medicare numbers or Social Security numbers must not appear on the notice, so don't use those numbers. Blank D is for the description of the services that are going to be provided. They should be as accurate as possible. Don't use descriptors like healthcare services or therapy services. Try to get the exact service down so that the beneficiary is notice of what you plan to give them and why the services are not going to be covered. Continuing on with that, the notifier must list the specific names of the items or services believed to be non-covered in the column directly under header blank D. In the case of partial denials, notifiers must list in the column under blank D the excess components of the item or service for which denial is expected. For repetitive or continuous non-covered care, notifiers must specify the frequency and/or duration of the item or service. When a reduction in service occurs, notifiers must provide enough additional information so that the beneficiary understands the nature of the reduction. For example, entering wound care supplies decrease from weekly to monthly would be appropriate to describe a decrease in frequency for this category of supplies. Just writing wound care supplies decreased would be insufficient. Blank E, reasons Medicare may not pay. In the column under this header, notifiers must explain in beneficiary-friendly language why they believe the items or services listed in column under blank D may not be covered by Medicare. 3 commonly used reasons are Medicare does not pay for this test for your condition, Medicare does not pay for this test as often as this, denied is too frequent, or Medicare does not pay for experimental or research use tests. Blank F is the estimated cost. Notifiers must complete the column under blank F to ensure that the beneficiary has all available information to make an informed decision about whether or not to obtain potentially non-covered services. Notifiers must make a good faith effort to insert a reasonable estimate for all items or services listed under blank D. For a service that costs $250, any dollar estimate equal to or greater than $150, between $150 and $300, and no more than $500. For a service that costs $500, any dollar estimate equal to or greater than $375, between $400 and $600, no more than $700. I would highly recommend in this case just to put the exact amount you're going to charge the beneficiary. Don't bother around with estimated costs. You should know exactly what you want to charge and charge them then that, so it's just a clear transaction and it won't create any tension in the future. Multiple items or services that are routinely grouped can be bundled into a single cost estimate. Average daily cost estimate is also permissible for long-term or complex projections. And as noted above, providers may also pre-print a menu of items or services in the column under blank D and include any cost estimate alongside each item or service. The following are the options the beneficiary can choose in regards to the ABN. Option 1 reads, I want D listed above. You may ask to be paid now, but I also want Medicare billed for an official decision on payment, which is sent to me on a Medicare summary notice, or MSN. I understand if Medicare doesn't pay, I am responsible for payment, but I can appeal to Medicare by following the directions on the MSN. If Medicare does pay, you will refund any payments I made to you, less copays or deductibles. This option also allows the beneficiary to receive the items or services at issue and requires the notifier to submit a claim to Medicare. Option 2, I want the services listed above, but do not bill Medicare. You may ask to be paid now as I am responsible for payment. I cannot appeal if Medicare is not billed. This option allows the beneficiary to receive the non-covered items or services and pay for them out of pocket. No claim will be filed and Medicare will not be billed, thus there are no appeal rights associated with the option. Option 3, I don't want the services listed above. I understand with this choice I am not responsible for payment and I cannot appeal to see if Medicare would otherwise pay. This option means the beneficiary does not want the care in question. By checking this box, the beneficiary understands that no additional care will be provided, thus there are no appeal rights associated with this option. This option is a good idea if you feel the services are no longer reasonable and necessary and you want to give notice to the beneficiary, and you'll at least have it on record that you gave notice that you feel the services are not going to be covered and that the beneficiary would be otherwise liable, and that they decided they did not want the services, that they did not want to pay for it. At least you'll have this on record just in case there's any question of a bad discharge or anything like that, or abandonment of a patient. Blank H is additional information. Notifiers may use the space to provide additional clarification that they believe will be used to the beneficiary. For example, notifiers may use this space to include a statement advising the beneficiary to notify his or her provider about certain tests that were ordered but not received, information on other insurance coverage for beneficiaries such as a Medigap policy, if applicable, an additional dated witness signature, or other necessary annotations. The beneficiary or representative must sign the notice to indicate that he or she has received the notice and understands its contents. If a representative signs on behalf of the beneficiary, he or she should write out representative in parentheses after his or her signature, and the representative's name should be clearly legible or noted in print. The beneficiary or representative must write the date he or she signed the ABN. If the beneficiary has physical difficulty with writing and requests assistance in completing this blank, the date may be inserted by the notifier. ABNs do have a number of modifiers that must be submitted if you file a claim alongside an ABN. This is GA, GX, GY, and GZ. GA, a waiver of liability statement issued as required by payer policy, individual case. Report when you issue a mandatory ABN for a service as required, and it is on file. You do not need to submit a copy of the ABN, but you must have it available on request. GX is notice a liability issued voluntary under payer policy. Report when you issue a voluntary ABN for a service Medicare never covers because it's statutorily excluded or is not a Medicare benefit. You may use this modifier in combination with modifier GY. Modifier GY, item or service statutorily excluded, does not meet the definition of any Medicare benefit. Report that Medicare statutorily excludes the item or service or or that the item or service does not meet the definition of any Medicare benefit. You may use this modifier in combination with modifier GX. Modifier GZ, item or service expected to be denied as not reasonable and necessary. Report when you expect Medicare to deny payment of an item or service due to lack of medical necessity and no ABN was issued. A beneficiary must be notified far enough in advance of an event about which a decision must be made by the beneficiary so that the beneficiary can make a rational, informed consumer decision without undue pressure. Last-minute notification can be considered coercive, and coercive notice is defective notice. The notifier should hand deliver the ABN to the beneficiary or authorized representative. Where hand delivery is impossible, in furnishing items or services by telephone order, mail order, over the internet, ABNs still need to be executed in advance of furnishing the item or service, either by mail, fax, or an online form. CMS will not consider a telephone notice to a beneficiary or authorized representative to be sufficient evidence of proper notice for limiting any potential liability unless the content of the telephone contact can be verified and is not disputed by the beneficiary. If a telephone notice was followed up immediately with a mailed notice or a personal visit at which written notice was delivered in person and the beneficiary signed the written notice accepting responsibility for payment, CMS will accept that the time of the telephone notice as the time of the ABN delivery. Electronic issuances of ABNs are not prohibited. If a provider elects to issue an ABN that is viewed on an electronic screen before signing, the beneficiary must be given the option of requesting a paper issuance over electronic if that's what they prefer. Also, regardless of whether a paper or electronic version is issued, and regardless of whether the signature is digitally captured or manually penned, the beneficiary must be given a paper copy of the signed ABN to keep for his or her own records. An electronic retention of the signed ABN is permitted. CMS will not consider delivery of a notice to be properly done unless the beneficiary or authorized representative was able to comprehend the notice. A comatose person, a confused person, someone who has experienced confusion due to senility, dementia, Alzheimer's, a legally incompetent person, a person under great duress, for example in a medical emergency. These are not considered to be able to understand and act on his or her rights, therefore necessitating the presence of an authorized representative for the purpose of the notice. An authorized representative should have the beneficiary's best interests at heart and should be reasonably expected to act in a manner which is protective of the person and the rights of the beneficiary. In absence of some more compelling consideration, the order of priority of the authorized representative is the spouse unless legally separated, an adult child, a parent, an adult sibling, or a close friend defined as an adult who has exhibited special care and concern for the patient, who is familiar with the patient's personal values, and who is reasonably available. The ABN must be prepared with an original and at least one copy. The beneficiary is given his or her copy of the signed and dated ABN immediately, and the notifier should retain the original ABN in the beneficiary's record. In certain situations, such as a delivery by fax, the notifier may not have access to the original document upon signing. Retention of a copy of the signed document would be acceptable in specific cases such as that. In general, it is 5 years from discharge or completion of the delivery of care when there are no longer applicable requirements under state law. Retention is required in all cases, including those cases in which the beneficiary declined the care, refused to choose an option, or refused to sign the notice. Electronic retention of the signed paper document is acceptable. The routine notice prohibition. This means giving ABNs to beneficiaries where there is no specific identifiable reason to believe Medicare will not pay. Notifiers should not give ABNs to beneficiaries unless the notifier has some genuine doubt that Medicare will make payment as evidenced by their stated reasons. Generic ABNs are routine ABNs to beneficiaries which no more than state that Medicare denial of payment is possible or that the notifier never knows whether Medicare will deny payment. Such generic ABNs are not considered to be acceptable evidence of advance beneficiary notice. The ABN must specify the service and a genuine reason that the denial by Medicare is expected. ABN standards likewise are not satisfied by a generic document that is little more than a signed statement by the beneficiary to the effect that should Medicare deny payment for anything, the beneficiary agrees to pay for the service. A notifier should not give an ABN to a beneficiary unless the notifier has some genuine doubt regarding the likelihood of Medicare payment as evidenced by its stated reasons. Giving ABNs for all claims or items or services is not an acceptable practice. A notifier is prohibited from obtaining a beneficiary's signature on a blank ABN and then completing the ABNs at a later time. An ABN to be effective must be completed before delivery to the beneficiary. CMS will hold any ABN that was blank when it was signed to be defective notice, and that will not protect the notifier from liability. Exceptions to those prohibitions include services which are always denied for medical necessity, experimental items and services, frequency-limited items and services, and medical equipment and supplies denied because the supplier had no supplier number or the supplier made an unsolicited telephone contact. An ABN should not be obtained from a beneficiary in a medical emergency or otherwise under great duress when circumstances are compelling and coercive, since that individual cannot be expected to make a reasoned and informed consumer decision. A requirement for delivery of a notice is that the beneficiary or their authorized representative must be able to comprehend the notice, and they must be capable of receiving notice. If after completing and signing the ABN, a beneficiary changes his or her mind, the notifier should present the previously completed ABN to the beneficiary and request that the beneficiary annotate the original ABN. The annotation must include a clear indication of his or her new option selection, along with the beneficiary's signature and date of the annotation. In situations where the notifier is unable to present the ABN to the beneficiary in person, the notifier may annotate the form to reflect the beneficiary's new choice and immediately forward a copy of the annotated notice to the beneficiary to sign, date, and return. In both situations, a copy of the annotated ABN must be provided to the beneficiary as soon as possible. If a related claim has been filed, it should be revised or canceled if necessary to reflect the beneficiary's new choice. If the beneficiary refuses to choose an option and/or refuses to sign the ABN when required, the notifier should annotate the original copy of the ABN indicating the refusal to sign or choose an option and may list any witnesses to the refusal on the notice, although this is not required. If a beneficiary refuses to sign a properly delivered ABN, the notifier should consider not furnishing the item or service unless the consequences, such as the health and safety of the patient or civil liability in the case of harm, are such that it is not an option. In any case, the notifier must provide a copy of the annotated ABN to the beneficiary and keep the original version of the annotated notice in the patient's file. A beneficiary who has been given a properly written and delivered ABN and agrees to pay may be held liable. The charge may be the supplier or provider's usual and customary fee for that item or service and is not limited to the Medicare fee schedule. If the beneficiary does not receive proper notice when required, he or she is relieved from that liability. A notifier will likely have financial liability for items or services, or if he or she knew or should have known that Medicare would not pay and fails to issue an ABN when required or issues a defective ABN. In these cases, the notifier is precluded from collecting funds from the beneficiary and is required to make prompt refunds if funds were previously collected. Failure to issue a timely refund to the beneficiary may result in sanctions. A notifier may be protected from financial liability when an ABN is required if he or she is able to demonstrate that they did not know or could not reasonably have been expected to know that Medicare would not make payment. If a refund is required, they must be made within specified time limits. The refund must be made to the beneficiary within 30 days after the date the provider receives the remittance advice if the provider does not request review of an initial full or partial denial. Or refund must be made to the beneficiary within 15 days after the date the provider receives notice of the review determination if the provider requests review within 30 days of receipt of the notice of the initial determination. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.